Hi, I'm very excited to introduce our new Halsted ESC2 platform. Thank you for taking the time to learn about our great new eye chair. We have put many years of market intelligence, clinical insight, and feedback from our most loyal customers into making this the best ophthalmology platform in the world. Let's start with a brief overview of the Halsted ESC2. First, let's take a quick peek at the hand pendant, the new way to manage patient flow and throughput. Next, I'll show you the platform from the ground up to explore the great new features we've added. We'll then circle back to the hand pendant to show how easy it is to operate this new eye chair. To wrap up, I'll cover safety features and optional accessories. The brains of our new Halsted ESC2 chair, our hand pendant. Let's cover some of the general functionality on here, some of the preset buttons, and some of the programmable buttons real quick. Let's start off with our general functionality, your traditional high-low, your back tilt, a brand new feature we've added, which is the seat tilt, and your foot tilt. Coming across, we go into our smart caster system, which is either the brake or steer or neutral. We then have three preset buttons, Trendelenburg, supine, and the chair position, which is also the home position. Last but not least, we have three programmable memory functions for pre-op, post-op, OR, or for any doctor's needs as well. Based on clinical input, we've designed this platform to easily accommodate patients up to 600 pounds. The base of the ESC2 features a spider design for improved stability. The dual smart casters provide smooth and comfortable transport. The powered column has a 20 to 40 inch height range for maximum accessibility and surgeon preference. The base and column are home to your standard IV pole, your column guard, power cord, and lithium-ion battery pack. We introduced the lithium-ion batteries to increase battery life up to 30% more than older lead-acid batteries. The patient surface on the new Halsted ESC2 is 26 inches wide. The pad features a 3-inch comfortable polyfoam with an encapsulated Duragel insert and memory foam in the seat cushion. The pad system is a Prima Stretch urethane that is extremely comfortable and durable. Prima Stretch is made to withstand repeated and extensive cleaning. It is also designed to help keep patients stationary for eye procedures. The two-position side rails are easily engaged with the release knob. They lock in the fully upright or the stowed position. There are two secure IV ports on both sides of the patient's surface that do not impact the function of the side rails or the footprint of the chair. For your taller patients, we have a powered foot extension that can extend up to 8 inches with a push of a button. Like the entire Halsted chair line, we included a two-position patient footrest for comfort, not to be used as a step. You will notice the foot section does not go fully vertical when in home position. This is to prevent improper patient ingress and egress. Nurses should direct and assist patients to transfer from the side of the chair like so. Our proprietary head section includes a head tilt knob and a chin tilt knob to allow perfect patient positioning for the surgeon and procedure. First, the head tilt knob. Now, the chin tilt knob. As you can see, wherever I stop, the headpiece stops. There is no play or drift. Let's take a deeper look into our new Halsted ESC2 hand pendant. Right now, I'm in chair position, which is a 20-inch seat height for easy entrance and exit for patients. We also label this as the home position or chair position. While we're in this preset position, let's go ahead and show you the other two preset positions and then we'll go into some general functionality. So secondly, I'll go into supine. You'll see the chair raise a little bit, and it will start to tilt to keep me lean back a little bit if I were a patient. So now we're getting into full supine just by holding the button down. You do have to hold the buttons down for the process to work. Now that we're in supine, we'll show you Trendelenburg, which is a preset button. We go to 0 to 15. You'll see that now. Now, to get out of any of the preset positions here, I can hit the home position or any of the other general functions, which we'll cover in a second, and that'll take me to whatever button I hit. So now I'm going to the home position, which is the chair position, dropping me back down to 20 inches, and I'm home. Now, just to show you some general functions on the chair, we have the traditional high-low. As you can see, the chair raises. Again, we go from 20 to 40 inches on the column. Next, we have a back tilt. Third, which is a new feature that we talked about a little bit earlier, is our seat tilt, which allows us to go into a 15-degree tilt, keep the patient positioned backwards, and hit some other procedures you may not have been able to do in the past. To get back out of seat tilt, you just hit the seat tilt down, and it's going to take you back to a flat position on the column. And last but not least, your foot tilt to raise and lower the foot section. So we've covered the 3 preset positions: home, Trendelenburg, supine. We covered the general functionality. Now let's jump into steer. Covering the steer function of the hand pendant, which is the preferred way to engage our chair. Most facilities are used to a manual interaction with foot pedals on other stretchers and chairs. We prefer you to use the hand pendant, and we'll go over that now. There's 2 buttons on the hand pendant to engage the dual smart casters. You have a brake button, which is going to lock the chair in place. The chair is stationary. You can also hit brake again to disengage. The chair will go into neutral. All 4 wheels will swivel. And then there's a steer functionality, which is going to lock your foot end casters into steer mode, where the back 2 swivel and the front 2 track straight ahead. These casters can also be engaged manually by the blue tabs. Again, primary way is the hand pendant, secondary is the blue tabs. To engage them with the blue tabs, if I press down very lightly, you get into lock. It's going to lock all 4 casters stationary. If I go just a touch up, it's going to engage all 4 into neutral, all 4 swivel. And if I hit the upper tab up, it's going to lock this into steer again, where the 2 foot casters lock, the 2 head casters swivel. The new ESC2 chair has infinite positions. For ease of use and efficiency, you have the ability to program 3 frequently used positions. For example, a pre-op position, OR position, and post-op position, or even surgeon preference. To program, adjust the chair to the desired position, hit the memory button until it flashes, then select 1, 2, or 3 simultaneously until you hear an audible beep. Once the audible beep is finished, you have now programmed this position into the memory of your hand pendant. If needed for patient safety, the pendant has a lockout function to either lock certain functions or the whole hand pendant. To lock the hand pendant down, you're going to hold the lock button down. You'll get the green flashing lights. Once they go solid, the hand pendant is locked. To unlock the hand pendant, you hold the lock button and the battery button simultaneously. thus opening the hand pendant for use. The new ESC2 integrated push handles are engaged by 2 release knobs. There are 2 locking positions, fully stowed, fully extended. For ideal ergonomics, the push handles rotate and lock in various positions to accommodate staff preference when transporting patients. When transporting in supine position, the integrated push handles should be fully extended. As you can see in stowed position, the ESC2 push handles are completely out of the way to provide maximum accessibility for surgeons during procedure. The Halsted ESC2 ophthalmology platform features an emergency override lever for a controlled drop to supine if a patient is crashing. To go from supine to Trendelenburg, you will then engage the Trendelenburg button or the seat tilt function to position the patient into true Trendelenburg. Another safety feature is an automatic smart caster lock. After 30 seconds of being stationary, all 4 smart casters engage to lock position. This feature protects your patients against unsupervised movement. The Halsted ESC2 chair will not return to home position while the foot extension is out. You will hear an audible alarm reminding you to retract the foot extension. This prevents the foot section from contacting the ground. Once you've put the extension back in, you will then be able to go into home position. A few of the accessory options for the ESC2 include the following: a full U wrist rest, or we have it in a dual wrist rest. We also have a contoured headrest set. It comes in a set of 3 with a 2, 2.5, and 3-inch base thickness. We then have our upper arm or shoulder supports. These are detachable, as you can see. Next, we have our monitor IV pole, which is different than your standard vertical pole. This holds a monitor up to 25 pounds. We also have the high-low foot switch for the surgeon to adjust the platform high or low to get it into perfect procedure height. Make sure to check halsted.com for the latest accessories. Thank you for taking the time to learn about the new ESC2 eye chair from Halsted. I hope this training video, in conjunction with an on-site evaluation, provide you the knowledge and insight you need to make the right choice for your facility.